Gus Alva. I'm currently the medical director of ATP Clinical Research, a private neuropsychiatric clinical research group that houses a center of excellence in the city of Orange in California. Super happy to be here. I had the pleasure of actually spending time with our chirurgeon when it came down to difficult to treat depression and neuromodulation, specifically the utilization of vagal nerve stimulation. And one of the neat things is that clinicians should know that there is a stepwise progression towards the consideration of things beyond medications. And ultimately, we're seeing a broadening of the horizon of the different things that we have at our disposal. Not just medications that typically would be utilized in augmentation, but other things, including IV ketamine, intranasal esketamine, repetitive transcranial magnetic stimulation, even something as esoteric as deep brain stimulation, right? But vagal nerve stimulation kind of falls right smack dab in the middle, and it shouldn't necessarily be considered a last step, but again, should be taken in the context of the data that we're now seeing emerging, where there's a lot of people that go through a lot of difficulty, need something more, and it's kind of nice to be able to align them with something that's going to work for them. So vagal nerve stimulation is not something that is just relegated to, say, some sort of a higher degree of chronicity, but it should be actually taken into consideration a bit sooner. Somebody's not necessarily fared well with 4 or more different interventions, then they're a great candidate. Say somebody that's already tried several different treatment modalities, psychotherapy, medications, augmentation, IV ketamine, intranasal esketamine, ECT, right? Is there something else that could be done? The answer is yes. There's a lot of people that prefer something that's going to be working 24/7, and that's pretty much the one modality that does that. But it's also important to understand that it might not work right away, right? So if what we're looking at is the acuity of onset of benefit, that may actually linger a little bit, but there appears to be a buildup where you really see nice benefits subsequently ensuing. It's important to take into consideration, though, that contrary to the perception that you can't utilize vagal nerve stimulation in an outpatient setting, you can, so long as you've contacted the appropriate individuals, in this case LivaNova, so as to be able to get a device that actually helps you program the specific device that the individual's using. Then you can actually cater it perfectly, personalize it to the individual that is receiving the treatment. So the other 2 sessions that I'll be participating in today, we're going to talk about insomnia. We're going to talk about the importance of sleep. We're going to be talking about what happens when you've got excessive daytime sleepiness. Why does that happen? Are you a night shift worker? Do you have obstructive sleep apnea? Do you have some type of a problem that's interfering with your ability to actually equilibrate that glymphatic system, meaning interstitial fluid that basically commingles with cerebrospinal fluid that allows the clearance of stuff that you don't want in your brain, like beta amyloid. That's really important, right? And if you've got carryover effects, meaning you're really sleepy, you might get into a car accident. You might end up making some foolish mistakes just based on the fact that you're pretty tired, right? So the nice thing is being able to recognize it, but the other important thing is how to fix it. And there are different types of agents that can actually help with that, dependent on, again, where it's coming from. It's not a bad idea to be able to identify what's going on and then subsequently utilize an appropriate agent.